All right, so I am traveling for work, teaching on the road again. And that means, oh nice. That means that it's time for another case study. So just like the last video, when we did a case study, I'm gonna talk about a patient's case. I'm gonna tell you the manifestations, and your job is to tell me in the comments what you think the patient's presenting with, and if you can, give some treatment interventions that you would do. In the next video after this, I'm gonna read your comments, and together we're gonna collaborate and we're gonna come up with a really good treatment plan for this patient. And of course, we're also going to talk about all the different manifestations and what they mean. Ready? Let's go. So this patient is a 72-year-old patient. She's a female that I just treated. She's presenting because of trouble sleeping at night. So she's waking up in the middle of the night. Light noises wake her up. Her upstairs neighbors wake her up when they stand up and they walk, and that noise wakes her up. After that, she can't go back to sleep. Sometimes she just wakes up on her own and she can't go back to sleep. She's attributing it to old age. She's 72 years old. Now, beside that, she has some anxiety. She has some depression. She also has night sweating. Well, she used to have night sweating. Now she doesn't anymore. Now she just feels very dry. Her palms do feel hot. Her chest sometimes feels hot as well, hot to the touch. Her tongue is dry. There's no coat there. It does look puffy to me. It looks swollen to me. Her pulse is very superficial. It's floating. And when you push down, it's barely there. It's empty. It's not even there. There's nothing there at all. So it's floating, and then you push down, and it doesn't feel like there's anything there. All right. So what do you think this patient is presenting with, and what treatment interventions will you do? Next episode, I'll read your comments, and together we'll collaborate and come up with a really good treatment plan. All right, until next time.